This is my presentation for the accuracy of first trimester combined test screening, and specifically for trisomy 21, 18, and 13. I'm Skylar Rogers, if you did not know. But yeah, I'm gonna go to the next slide. So some background on this article. This study was conducted in the year 2016, so even though it is not super recent, it is still quite relevant. And this study specifically targets only 3 chromosomal abnormalities. There are many different kinds, but these are the ones it mainly focused on, and these are the ones I'm mainly going to be talking about today. This article is published in an official obstetrics and gynecology book as well, which I'll talk about a little bit more in a minute. And the study took place in the United Kingdom, specifically London. Even though it did take place in a different country, it's still relevant. And all of the authors do work in the field of OBGYN, such as maternal fetal medicine, women's health, just stuff like that. So they're all credible. I didn't specifically cite where they work for, but I just wanted to put that out there. So for publishing, the specific edition of the obstetrics and gynecology book that this was published in is volume 49 and issue 6. This publishing is it's very well known, and it provides a lot of information for up-and-coming physicians on ultrasound technology and how to read ultrasounds, and just a lot of base knowledge. So for the main side authors for this article, I'm just going to read off their last names. It's Sanatorium, Wright, Singalecki, and Karagiati. I think I butchered all of those, but that's okay. They are all found out of research hospitals for fetal medicine or women's health that are located in the United Kingdom. The corresponding author for this article is Kypros Nicolaides. He is a professor of fetal medicine, and he's located at the King's College Hospital in the United Kingdom. This professor has been in this field for about 20 years now, so he's quite knowledgeable. He has a lot of different research articles out there if you find this interesting. You can just go onto Google Scholar, or you can use the Kettering Library and find a lot of his articles. He does a lot of research about chromosomal abnormalities and diagnosing them preterm rather than after. So I find it really interesting that he is focused on this one study. So my motivation for picking this article personally, my goal is to become a physician's assistant, and for my specialty as a physician's assistant, you can change specialties, but specifically, I'm looking into being a pediatric PA or an OBGYN specializing with mothers, probably more OB, but yeah. I also find prenatal tests very interesting because they provide information really early. I worked with an OBGYN, and I thought it was really interesting how many tests you can do to find out different things, like before childbirth, and how much like being pregnant changes your body and stuff. So I just find that interesting. So the purpose of this article is to determine the accuracy of these tests that are used during the first trimester to discover the chromosomal abnormalities. They just wanted to go in and make sure that these tests are still accurate and providing good results. So that is the main purpose of this article. So just a quick overview of the abnormalities that are being studied today. I am going to talk about these in a lot more detail later on, but I just wanted to give a quick overview. So first, we have trisomy 21, also known as Down syndrome. A lot of people, this is probably the one you think of most commonly when you think of a chromosomal abnormality. We also have trisomy 18, which is known as Edwards syndrome, and trisomy 13, which is known as Patau syndrome. So, what was assessed, of the mother during the first trimester? So, the first thing that physicians look at is the maternal age. Normally, if the mother is over the age of 35, they're at a higher risk of having a child with a chromosomal abnormality. They also look at things such as the fetal nuchal translucency, the fetal heart rate, beta human chorionic gonadotropin, which is the thing your body produces when you're pregnant. So that's what shows up, like if you have a pregnancy test and it says yes, that's the hormone that your body is recognizing. And they also look at pregnancy associated plasma protein A. So if any of these seem abnormal, the doctor is going to order one of the following tests, which I'm going to talk about a little bit. So yeah. So after they notice these abnormal labs, they're going to send the mother for one or two things. So either for a chorionic villus sampling, also known as a CVS. I'm going to talk about that in a bit more detail later on as well as an amniocentesis, which is also known as an amnio. That kind of depends on the doctor's discretion on which one is ordered. They both provide pretty good results. I don't think one's better than the other. I think it just depends on the doctor and what they prefer. But yeah. So the quick overview of the general results, it shows that this test is still pretty accurate, and it provides good information around 11 to 13 weeks of gestation, so the mother knows and can prepare for what's about to happen with their baby, and so that they can get ready to their baby. Further detail. So going into further detail about these chromosomal abnormalities, the first one I'm going to talk about is trisomy 21, also known as Down syndrome. So I have this picture here. Here is where the abnormalities. There's an extra chromosome. Sorry, my circling is pretty bad. But there's an extra chromosome there, and this happens during cell division. There's just extra genetic material left over, and it just ends up there. So this occurs in about 1 out of 700 babies. So it's probably the most common kind of abnormality, but still not very common. So the physical differences that this can lead to is a short neck, small ears. They can also have loose joints, and they also have a higher risk of heart defects. I have this from personal experience. I worked with a pediatric cardiologist, and any patient that we saw that had Down syndrome automatically got an echocardiogram, which is just an ultrasound of the heart to make sure that there weren't any heart defects. I think that they get them pretty soon after birth as well. And also this can lead to developmental delays. So for trisomy 18, you can see that right here. Here's the extra chromosome. There's 3 there. Physically seen, they'll have a small jaw. Their head may be abnormally shaped, and their fists might be clenched like permanently. Their fingers might be like intertwined, kind of weird. So those are some things you may see physically. And then effects that this may cause, they may have a low birth weight and slow growth, so they may always fall behind on their birth chart. Like when you go in for your monthly checkups, they'll always fall behind, like no matter how much you feed them. Yeah. They'll also have a high risk of heart defects as well. That's just a common thing with anyone with a chromosomal abnormality. Sorry, I keep butchering that word. So trisomy 13, Patau syndrome. Here is where the extra chromosome is. And physically seen, you'll see small eyes, cleft lip or palate, weak muscles as well. Effects that this can have, they may have a spinal cord defect or a heart defect as well, or a brain abnormality. So going into the specifics of the testing, I'm first going to talk about chorionic villus sampling, which is also known as CVS. This will give information about chromosomal abnormalities. I've been saying that a lot, sorry. So this can be done two ways. So the first one is transcervical. This is the most common way. This is most likely what's going to happen. That's the top picture. So I'll draw an arrow and I'll highlight this like kind of in purple. But they will use a biopsy catheter. They'll go through the vagina and they'll reach the placenta and grab some tissue out of there. That tissue is going to be sent for testing. The other way is transabdominal. That is this bottom picture right here, this bottom diagram. As you can see, I'm sorry, I forgot to. This is the biopsy catheter up here, and this is the where it goes in, and then that's where they grab the tissue from. For transabdominal, though, the needle's inserted through the abdomen and through the uterus to get to the placenta to obtain the tissue. So it's about right here, but they insert a needle up above that. It's sent for further testing. Takes about 2 to 3 weeks to get the results back. So the other way is through an amniocentesis, also known as an amnio. The way that they do this is they take a little bottle and they're first going to do an ultrasound and make sure that the baby's in proper position so they're not poking and prodding at the little baby. Stick a needle through, and they're going to take some amniotic fluid out from the amniotic sac. This fluid is going to be sent for testing as well and scanned for any abnormalities. I think this takes a couple weeks as well. So the results, after they get the results and after the mothers have the kids, this is compared with the results from the children. So they're going to take a sample of the blood and they're going to run a karyotype, and they're going to compare that to the karyotype that was obtained via CVS or with an amnio. So that's how this article obtained their results. So limitations of this study. They had to be sure that the participants would still deliver the baby or would still be able to deliver the baby. So they had to keep track on all their participants. If they had an abortion, they had to know that so they knew that their amount of people in the study went down. If they had a miscarriage, they also need to know that, just because these abnormalities are normally associated with a high number of intrauterine deaths. So a miscarriage, essentially, especially if the mom's maternal age is higher, they're more than likely not going to carry to full term or have the baby early. So the results. So quickly, DR stands for diagnosed rate. That is here on the Y. And then SPR is screen positive rate, and that's here. So the screen positive rate is when they do the testing via CVS or amnio. Diagnosed rate is after the baby is born, and they do testing via blood. So it is seen, they have it for trisomy 21, 18, and 13. They show all the different results, but it is seen that these all follow the line of best fit. They all show really good results, and there aren't much discrepancies seen among these. So this is pretty good for this study. I mean, there's a little discrepancy here for trisomy 13, but it's not very significant at all. For this other graph, it's just a different way that they displayed the data. They have a line of best fit here, and they have all the deviations of this. These all pretty much follow the line of best fit. They're not very far. At least some point of, that was a really bad arrow, I'm sorry, but at least some point of the deviation lands into the box. So, but we're going to go into numericals now. So statistically, tests done during the first trimester detected the following. So 90%, they were accurate 90% of the time for diagnosing trisomy 21 during the first trimester. 97% of the time, they were accurate for trisomy 18, and 92% of the time, they're accurate for trisomy 13. I'm just showing this extra results because I just think it's interesting. They were accurate 95% of the time for detecting monosomy X in triploides, and they were accurate 50% of the time for other chromosomal abnormalities. So for my primary article, I did maternal age in relation to the chromosomal abnormalities. The corresponding author here is Kypros Nicolaides, who we all know where he's at. He's in the UK. This is a picture of him with this cute baby. And I thought it was cute, so I just put it in there. I really like babies. So the study that was done, they studied just the chromosomal abnormality trisomy 21 for women over the age of 35, so with a higher gestation or maternal age, sorry. And to be eligible for this study, they must have had a fetal karyotyping done between weeks 9 and 16 of gestation. So the results that were shown, out of the 7,614 pregnancies that were studied, 538 cases of trisomy 21 were prevalent, and then specifically in weeks 10 to 14, 329 observed cases of trisomy 21. So with this, they concluded that the risk for trisomy 21 will increase with maternal age, but it will decrease with gestation. So for this, there wasn't a specific figure. I looked through a lot of the different primary articles and references that my article had, but a lot of them didn't have figures. A lot of the figures were found just because this is more of a statistical thing. So conclusions made from the studies, they were both very helpful and insightful, and they both showed great results and showed that what we're doing is working and how we're studying these abnormalities are working. So it's just nice to have some input. And then, are there any questions? Obviously, I'm recording this right now, but in person, you can ask me a question.